Morning, everyone. Thank you, Munir, and thank you to all who've contributed to this project. It's an important collaboration between the NIHR, CRN, and the UK Pharmacogenetics Stratified Medicine Network, in other words, all of you. And it was very much about trying to ensure that we can increase, maximise and support delivery of stratified medicines within the CRN. As Sir John mentioned, sometimes it's helpful just to contextualise where this fits within NIHR. So the Clinical Research Network is part of the significant investment in infrastructure and works closely with other elements of infrastructure that is often part of the pipeline of StratMed studies that we're trying to support and deliver. Sir John also got it right that they're called MICs now, but he's left. So importantly, in terms of the communities of healthcare professionals, researchers who are trying to deliver stratified medicine, we've tried to work very carefully across our NIHR CRN community. And in particular, the fact that we do have 30 specialties. They're actually national specialties, so have representation from the devolved nations. We also work closely with our colleagues in the devolved nations in terms of their research network infrastructure. And in addition to that, we also have local clinical research networks, the LCRNs, which are the frontline delivery staff delivering the studies within NHS environments. So these are important communities, they're important resources, and they're what the CRN is about in its day-to-day practice. In other words, we have a process that supports all steps of clinical study delivery, and all of these are available for and indeed support delivery of stratified medicine studies and have done for many years. But this project was very much about looking at that and seeing whether or not everything is in place to maximise the delivery and whether the CRN itself needs to evolve itself in order to improve that delivery. So the initiation of this was from a stocktake that took place back in 2015 by Nancy Lester and Jane Beattie, who is here today, was really a self-reflection. Are we good? Are we doing well in delivering stratified medicine studies? And that was both within the CRN and in conversation with stakeholders, external partners, industry, and so on and so forth. And it was recognised that there were some areas that we perhaps would like to improve. And this, therefore, is the workshop that was held with the UK Pharmacogenetics Stratified Medicine Network just almost 18 months ago here in London. And it was a very, very successful workshop, very helpful workshop to set the scene for our project going forward. And these were some of the key findings that emerged. One was the importance of engaging with the NHS itself in delivering stratified medicine studies. That may seem self-evident, but there was sometimes a reflection of disconnect between those trying to drive forward and develop stratified medicine studies and actually frontline NHS staff. It was important, therefore, to meet the needs of the delivery staff in terms of their ability to be able to deliver stratified medicine studies. There was a question whether the CRN needed to evolve to be better suited to deliver stratified medicine studies, and obviously that was a reflection in much of the work of the project. And then also, is there a need to increase the learning available to help investigators, but also the wider community know how studies can be delivered in stratified medicine? Along with that, there were some key messages that came through, and we've heard many of those filtered through the other talks this morning. Involving patients early. This was critical, and we've taken that forward and also continue and will continue to do this in a number of ways that I will come back to. Exploring incentives to support delivery of stratified medicine studies, but also to overcome some of the either perceived or real disincentives to delivering stratified medicine. And also recognising that there is a large infrastructure there in place for delivering studies across the NHS as business as usual within the CRN. But sometimes those services and those messages and the successes of those aren't always shared or promoted or don't have visibility. And therefore, the project group gathered around a number of key domains, surmised in this acronym DELIVER, very much focused on delivering stratified medicine that was relevant to the patient. And for the time today, I will just focus on some of the key headlines emerging from the project and where our next steps will go. But leadership in delivering stratified medicine studies was a key focus of our reflections. And the way we've taken that forward is to actually identify, firstly within our specialties, albeit 29 out of 30 so far, stratified medicine champions. And indeed, there are 4 or 5 present in the audience, and I'm sure they will flag that and make that known in their conversations with you all. But this means that within each of the 30 specialties, there are champions who can help advise those communities in terms of translating and understanding what resources and facilities and what stratified medicine studies mean. But also in terms of the local delivery networks, we've identified stratified medicine delivery facilitators. Therefore, within each of the geographical areas, there's a go-to person across all specialties to help. And together with those of us already involved in stratified medicine, including those present, we're developing a CRN Stratified Medicine Community, which I think is going to be very helpful. In addition, empowerment, providing an intranet site which, although is within the CRN intranet, is open to the public for a resource that is helpful to those who are trying to address and deliver stratified medicine studies. This includes contacts and links to our champions and facilitators, podcasts giving information, self-learning tools, and particularly bite-sized chunks of learning, but also links to external resources, because we very much not wanted to reinvent the wheel. And there are many resources both within the UK StratMed network and MRC and other stakeholders that are pointed to here. There are some important innovations in how we can support and facilitate further stratified medicine studies. Some of them are about actually unpacking what the funding models to support delivery of studies really mean and finding ways to support that as well as we can, but also looking at how we can engage with our communities. And there have been a series of workshops very much at local level, working with our LCRN teams. And indeed, the feedback from that is that very often stratified medicine studies are very much complex studies that need to be supported, and there is a whole package of resource around that in order to be able to help deliver those. One of the most important things, though, is to be able to identify stratified medicine studies as they come onto the CRN's portfolio, both in terms of project management, performance management and reporting, but also in order for us to identify and learn from those going forward. And we've established a new process to identify those so that right from when they come onto the portfolio, they will be able to be identified as stratified medicine studies. It's also recognising the work of the CRN in supporting stratified medicine studies and indeed identifying that there are a number of case studies. Indeed, one of them is very much linked to the hepatitis C programme, which Sir John mentioned before. In other words, let's celebrate where and give guidance to how the CRN has supported key stratified medicine studies so others can learn from it. But also in terms of training our next generation, working with the NIHR Training Coordinating Centre to make sure the stratified medicine programme and initiatives are incorporated into future training programmes. And interestingly, we did go outside to stakeholders, both within this community and elsewhere, to see are there any initiatives for helping delivering stratified medicine studies that we can all learn from that are out there. And very interestingly, both across industry and other stakeholders, there are no major initiatives that we're not aware of. So there are some digital tools and some other specific tools. But really the message was that there is some major opportunity for the CRN to work with the stratified medicine community, both this one and more broadly in terms of finding shared solutions. So going forward, there is continued work both in terms of further engagement with the NHS, and Munir has mentioned a workshop that we're co-hosting in the autumn, particularly for our stratified medicine champions and facilitators to engage with NHS colleagues. We input in, and many of our stratified medicine champions are going to the workshop with the MHRA in May. And this is a very important work that we're doing with our patient and public involvement engagement colleagues within the CRN and other initiatives in other StratMed communities to ensure that the language and the communication with our patients is optimised for breaking down the barriers and really helping and fostering their involvement engagement in stratified medicine. So in final, there will be a final report, which is short to be finished, that will be then published and disseminated, and we'll then be integrating and handing back within the whole of the CRN the core business of delivering stratified medicine across its structures. We will continue to work and continue to disseminate the work of the project with our stakeholders, including MRC, StratMed Community and others. And finally, this process of continued engagement with the NHS will progress. I want to give very special thanks to the project board who have worked on behalf of both the StratMed community and the whole of the NIHR CRN. In particular, very special thanks to Munir, who has been inspirational and very key in driving this forward to make sure we're contextualizing this within the StratMed community. Many of my colleagues within the CRN, in particular, we've worked across all of our clusters. These are clusters of specialties to make sure that we capture the needs and the challenges of each of our 30 specialties. But in particular, I want to acknowledge the support of Matt Seymour, who oversees the cluster that supports the whole portfolio of cancer studies. And in particular, we've talked a lot today of primary health, and particularly the work being led by Phil Evans, who is here also leading a genomics program, which we've integrated with the pharmacogenetics program, particularly on integrating and working with primary care. I want to thank other colleagues within the CRN, Chris Chamberlain, who's been our industry lead, James Peach from the Medicine Discovery Catapult, and also Jackie Pir-Mohammed, who's helped to ensure that the LCRNs and the LCRN's engagement with the programme is very much there. And finally to Carla Owen, who's done an immense job in trying to help project manage what has been a very important, and I think that will have a very important impact on improving delivery of stratified medicine studies. So thank you very much.